Have you ever wondered if there are specific eye conditions that are more common in women than men? Well, in today's video, that's exactly what we're talking about. Welcome to Salisbury Eye Care and Eyewear. I'm Dr. D. My goal is to arm you with the knowledge you need to take control of your eye health and have the best vision possible. Like and subscribe for videos every Wednesday at 8 p.m. Hello again and welcome back to my channel. I'm Dr. D. I'm a doctor of optometry with my own private practice. I'm residency trained in ocular disease and I specialize in dry eye. On this channel, I post educational videos about eye health and vision products. If you're new here, please consider subscribing and hit the bell so that you never miss a video. During today's video, I've added some additional notes down in the description below, so make sure to check that out to see more information. Today we're talking about the eye-related risks that are more prevalent in women than men. We'll talk about the reasons that that's the case, and finally, I'll give you some tips so that going forward you can have the best eye health possible. All right, so there are several eye conditions that are way more common in women than men. The most prevalent of those are cataracts, glaucoma, macular degeneration, and dry eye. The first one, cataracts. Pretty much, if you're a living, breathing person and you make it long enough, so i.e. you just live long enough, you will eventually get cataracts. Cataracts happen in the lens of your eye. When you're born and when you're a child, that lens of your eye is nice and clear. It's crystal clear. And as you get into your 30s and 40s, we all start to notice that we have trouble focusing up close. Well, the next change that happens to the lens of your eye is that you start to form a cloudiness, and that is a cataract. Cataracts affect us by making our vision a little bit blurrier. It can also cause glare at night. And a lot of my patients will notice they need more and more light to be able to see as they're developing cataracts. Cataracts can even shift your prescription. There's something called second sight that we see really often, where you might be nearsighted as a kid, and as your cataracts are developing, your prescription is actually changing and you're becoming less nearsighted. The second eye condition that's more prevalent in women as they get older is glaucoma. Now, there are many types of glaucoma, and this video is not meant to encompass all of those types. But in general, the concept behind glaucoma is that you have a high pressure in your eyes. Now, that pressure doesn't have to be too high for anybody's eye but yours. I am famous for saying to my patients that I have patients whose pressure is higher than the average, higher than the normal, but that's completely normal for that patient. So glaucoma occurs when that pressure is too high for your particular eye. When that occurs, damage is sustained to the optic nerve. You start to have nerve fibers that die. And as a result of that, because the nerve of your eye is what connects your eye to your brain and communicates back and forth, you can have actual vision loss. The problem with glaucoma is you don't typically feel high pressure and you don't notice that vision loss until it's too late because it happens in the periphery of your eye. Next on our list is macular degeneration, as we know it, ARMD, age-related macular degeneration. Again, not specific to women, but it is a condition that we see more often in women than men. We'll get into why that is in a minute. Macular degeneration is when the macula of your eye, so that's the area that gives you your sharp, detailed, central color vision. It's an anatomical point in the back of the eye that really does a lot of work for us throughout our lives in making us see. That portion of the eye ages more quickly than you do. Now, macular degeneration tends to run in families, and we'll get into some of the other risk factors and what you can do to prevent it as we get along in the video. But that's another one that's more common in women. And then finally, dry eye. This is my specialty area in my practice, but dry eye is so much more prevalent in women than men. Worldwide, women comprise over 64% of visually impaired people. Let's talk about some of the reasons why. All right, number one, women live longer. Statistically speaking, women are going to outlive their male counterparts, and as a result, these age-related eye diseases are going to be more prevalent in women than they are in men. Number 2, between hormones, birth control pills, pregnancy, all those hormonal changes throughout a woman's life can wreak havoc on our eyes. We know that just, pregnancy in general can put a woman at higher risk of gestational diabetes, hypertension. Some of these pregnancy complications can have long-term lasting effects on the eyes. Birth control pills and other hormonal changes throughout life can have vascular effects throughout a woman's body, and that can also have a lasting impact on the eyes. And finally, menopause. I made a video completely about menopause that we'll make sure to link above. And menopause has many, many effects on the eye that you can watch in that other video. The next reason that women are at higher risk of eye problems is that 1 in 10 women over 20 years old has diabetes. We talked about before how pregnancy can increase your risk of gestational diabetes. And if you've had gestational diabetes during your pregnancy, we know that later on in life, you're more at risk for developing type 2 diabetes. And so as a whole, just having diabetes can put you at risk for other eye problems. And so having diabetes is one of those reasons women have more eye conditions. Another reason a woman might have more eye conditions is smoking. So smoking is another one that's going to just increase your risk of cataracts, macular degeneration, and certainly we know lots of women smoke. Medications. So the research shows that women over the course of their lives just take more medications than men. And so there's always that risk that you're taking a medication that's going to have a side effect on the eyes. Most commonly I see are antidepressants, anti-anxiety medications, high blood pressure medications. But there's many, many, many more that do have eye implications. And we know that women over the course of their lives take not only more prescription medications, but over-the-counter medications as well. Finally, lifestyle definitely plays a role, not a risk like the others that's exclusive to women necessarily, but certainly obesity is going to play into that risk of eye problems because it increases your risk of other things, right? Like diabetes and other health problems. So lifestyle modifications will be something we talk about in a moment because that is so important. If you're going to live a long life as a woman, you want to do things that keep you healthy long term. Here are my tips if you're a woman because you know you're at higher risk of visual impairment throughout your life. We know that to be the case. Let's talk about some tips so you can keep your eyes healthy forever. Number 1, see an eye doctor regularly. This is so important, especially in our COVID environment, this COVID world that we're living in. Certainly at the beginning of the pandemic, we delayed all routine care. My office was closed for 2 months. It is so important, though, to keep up with your routine care, whether it's your eye doctor or any other medical professional or other medical professionals you're seeing. I do encourage you to keep up with routine care. We have implemented new standards in our office. We have so many protocols in place to keep you safe, and so don't delay that routine care. Everyone should have had an eye exam by the time they're 40 at a bare minimum. And after that, if everything's perfectly normal, your doctor will tell you every year to 2 years. But follow your optometrist or ophthalmologist recommendations because we do want to see you having routine eye examinations. There's certain diseases, especially glaucoma, that if you're gone for many, many years, because it's silent and because the vision loss, again, happens in the periphery of your vision, it can happen without you realizing it. And so regular eye appointments are the way you're going to find out if you have those risk factors if you're developing glaucoma. In contrast to glaucoma, macular degeneration affects the center of a person's vision. This makes it really hard to recognize faces, to read books, to read your mail and write checks. And so macular degeneration can be very devastating. It's definitely something you want to prevent if possible. My second tip for keeping your eyes healthy is to see your primary care doctor. And if you don't have a primary care doctor, yes, it's very, very important. I think sometimes as women, we get used to seeing our OBGYN, we get into that sort of care, woman care. We don't really think about seeing a primary care doctor as well. It is so important to have that member of your care team. So if you're one of those women that only has an OB or a gynecologist currently and you've just been keeping up with your woman visits, do consider adding a primary care physician to your care team because they're the ones that are going to take a look at your overall health. They'll pick up if you have diabetes, hypertension, and be looking at the entire picture. And like I said before, all of those systemic conditions affect the eyes. The eyes are connected to the whole body. And so I want to encourage you to get that primary care visit done. The next one is to maintain a healthy diet, exercise, make those lifestyle changes that are so, so important. As an eye doctor, my favorite things to recommend to eat are green leafy vegetables, and that's because they really help fortify and protect the back of the eye, especially spinach, collard greens, kale, Swiss chard, those really dark leafy greens. If you can eat those about 5 times a week, those are really helpful for the back of your eye. And it's easier than it sounds. That's just a salad at lunchtime, and if you can make that good decision once a day, then you're going to help your eyes long term. In addition to the green leafy vegetables, vitamins like vitamin C, vitamin E, anything with lutein. Green leafy vegetables do have lutein, but there's a number of other things that do as well, like eggs, orange and yellow peppers. And you can look up the list, but and maybe I'll actually link that down in the show notes. I'll get you a list of really healthy eye foods. But paying attention to that now will really help your eyes as they get older and prevent you from having vision problems. Another thing I like you to get in your diet is omega-3 fatty acid. This is so helpful inflammation-wise. It's helpful to almost every tissue in your body, and specifically for the eyes, it aids in decreasing inflammation when it comes to macular degeneration, as well as dry eye. So very, very helpful and proven to help in dry eye. My only caveat about omega-3 is that it has to be high quality pharmaceutical grade fish oil. Unfortunately, so many fish oils that are over the counter, your body can't use them very well. They're not purified like they should be, and you really would have to take a lot of them to get the level of EPA DHA that's helpful to your body. My favorite brand is Nordic Naturals, but there are many out there. If you flip the bottle over, look for the EPA DHA numbers. If there's a star, that means there's not enough in there to even really count. You want a brand that's going to be triglyceride form, highly purified. Nordic Naturals is. And when you flip that bottle over, the EPA DHA add up to over 1,000. All right, my next tip is do not smoke. And if you do smoke, try really, really hard to stop. And if you can't stop, then cut it in half, and then cut it in half again. Because the less you smoke, the better for the diseases, cataracts and macular degeneration. And even if you started in your teens or early 20s, there's no time like the present. I always say the best time to stop was yesterday. The second best time is right now, today. So if you do smoke and you've smoked for a long time, believe me, I know it's next to impossible to quit, but it is definitely worth your while, and that'll make a huge impact in your long-term eye health. So finally, I want to encourage you to wear sunglasses. Even on cloudy days, there's UV coming through those clouds, and it's so, so important to protect those eyes. That's going to reduce your risk of macular degeneration and cataracts as time goes on. As women, we are more prone to some of these eye diseases, cataracts, macular degeneration, glaucoma, and dry eyes. We live longer than men. We take medicines, we have hormones that change throughout our lives, and these things put us at risk. But that doesn't mean that you have to have a visual impairment. If you stay away from smoking, wear sunglasses, eat good healthy foods, eat healthy foods and shop the corners of the grocery store instead of the middle. You can do good things for your eyes and keep them healthy for a lifetime. Make sure to see your eye doctor and your primary care physician. Make sure to see your eye doctor and your primary care physician regularly. Thank you as always for tuning in. Be well, stay well, and join us every Wednesday at 8 p.m. for new videos. I'll see you next time.